Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I've been partnering with the Council on Aging in St. Tammany for many, many years. And a part of that partnering has been these caregiver coffee videos where we're trying to impart some information, some education and training on something around um, older age, caregiving, and things like that, in hopes that you will be a better caregiver if that's your situation, or if you are just taking care of yourself. And these are some tips that will help you. But you know, at some point, we will all need a caregiver, and many times we'll be a caregiver for someone else. So I hope that you will share this with others that you care about, because they may be taking care of you one day. So today we're going to be talking about medication safety. This is also, so we're kind of coming back a year after we've done a bunch of videos. We're coming back and doing similar topics in a different way. So I hope that you have seen those medication safety ones, and they're mainly for medication safety for older adults. I hope you've seen those already, and that this is sort of a refresher, but I think you'll learn some new things as well. The information from today comes from a number of reputable sources. It's grounded in the American Geriatrics Society 2023 Beers criteria. Yes, Beers is the name of the researcher, Beers, which identifies high-risk medications and common prescribing pitfalls for older adults. Data on medication-related emergency visits comes from Budnitz et al. 2016, New England Journal of Medicine, one of the most cited studies on adverse drug reactions in older adults. Additional safety recommendations come from the Institute for Safe Medication Practices, the Centers for Disease Control and Prevention, Medication Safety Program, and the National Institute on Aging. So, and I will put this in the description of the video in YouTube. Before we get into the meat of this video, just a little spiel, as I always do for our caregiver support group. We meet every Tuesday evening of the year. We publish a flyer slash calendar every 2 months with exact dates and locations. And you also will want to get on a private email list that we have. It's free to join this list. And really, it's just a reminder email on Tuesday mornings as to where we're going to meet. And also when we have typically there's a link to that flyer that I was mentioning. And certainly every time a new one comes out, it is sent on there. But typically I try to have it on there in case someone has just joined the group, join that email list. It is private, meaning that you're not going to see other email addresses. They're not going to, and no one else is going to see yours. We have a little over 100 people that are on the list receiving the email reminders. And the basic format of the month, if you're looking at, where do we meet and all that, the first Tuesday of the month, we're in Slidell at the Senior Activity Center. Again, it's at 6 p.m. to 7:30 p.m. The next Tuesday, so the second Tuesday of the month, you're using the online conference platform Zoom. The third Tuesday of the month, we're back in person, except we're in Covington. And then the fourth Tuesday of the month, we are back on Zoom. Sometimes there's a fifth Tuesday, and we will let you know ahead of time whether we have confirmation from Coast to meet on a fifth Tuesday. And we usually have it a placeholder, or we have it tentative on our calendars that we send them out. Okay. With that, let's get into this brief education that I hope is going to be very helpful. So let's talk about why medication safety matters for older adults. It matters for everybody, but for older adults especially. They metabolize medications differently, meaning slower kidney and liver function, meaning that the drugs stay in the body longer. Many seniors take from 5 to 10 medications, increasing the risk of interactions. And one of the studies I mentioned before by name, Budnitz and uh, and and colleagues found that over 100,000 older adults are hospitalized each year due to medication errors, and most of those are preventable. The American Geriatric Society Beers criteria highlights medications that are high risk for causing confusion, falls, and delirium in older adults. And caregivers are often the ones managing complex medication regimes, so small mistakes can have big consequences. So that's why we're talking about it. And medication safety is one of the easiest ways to prevent an ER visit. And after this, I think you'll see why. All right, so the top 10 medication mistakes. So this is going to be the bulk of what we're talking about today. Each mistake, I will tell you what the mistake is and why and what could lead to it. Number one, skipping doses. This happens generally due to forgetfulness or confusion. This can cause blood pressure spikes, uh, blood sugar swings, and withdrawal symptoms. The second common mistake, double dosing. Taking a dose twice because you or they forgot that they took it. This is especially dangerous when we're looking at sedatives, insulin, and blood pressure meds. Number three, mixing up pills. So many pills look similar as much as they try to use different colors and stamp them and things like that. They can look similar. Vision changes can make labels hard to read, and this can lead to taking the wrong medication at the wrong time. Number four, not understanding side effects. So dizziness, you might think dizziness, okay, most may think it's a big deal, but if you're someone who doesn't think dizziness is a big deal, it is because it could lead to falls. Falls lead to hospitalization, surgery, and eventually an early death, earlier than what could have been. Um, so dizziness is very serious, and you also want to consider having dizziness symptoms if someone is still driving or operating anything dangerous, even in the household. So dizziness equals falls. Just remember that. Next side effect is confusion. Confusion can often be mistaken for dementia, and then that leads to kind of like a cascade of stress and thinking that someone has dementia and what does that mean, and getting a workup and all that. So confusion is something that we want to avoid at all costs. Next is constipation. Yes, that's uncomfortable. We don't want that, but constipation can lead to a delirium risk. And in previous videos, we've talked about delirium and how bad that can be. So we want to avoid that side effect of constipation. We want to pay attention if it is a side effect. And the last one I'll cover is nausea. Now, nausea can lead to, of course, vomiting, and which could lead to dehydration, which can then lead to many things. So you can see how these side effects that we hear about on commercials or read on the label, how they can lead to more serious things down the road. So that was dizziness, confusion, constipation, and nausea. Side effects not to take lightly. All right, number 5. Mistake of 10, stopping medication suddenly. Blood pressure medications, antidepressants, and steroids can cause dangerous rebound effects. Many older adults stop meds because they are quote unquote feeling better. And I'm sure, a lot of people can feel tempted to do that. But we're talking about older adults, so they may think that they're better now. They're not feeling the symptoms because the drugs are working. But no, that just means that we need to continue them until the prescription ends or till the doctor recommends stopping them. There are food-drug interactions. Grapefruit, for instance, affects statin and blood pressure medications. Dairy interferes with some antibiotics, and vitamin K can affect warfarin. So you want to make sure that you are looking into that, even looking into your additional research at home, as well as talking with the doctor, the pharmacist, reading labels, reading the patient education that comes in with that, because some of these you wouldn't think of, right? Number 7, mistake. Using expired medications. This means reduced effectiveness, risk of contamination, and confusion about which medications are actually current. The 8th mistake, or eighth common mistake, not bringing medications with you to doctor's visits. So yes, it is highly recommended. You've probably heard of it before. We've probably talked about it in the past of bringing a brown bag, bringing your lunch bag with the medications that you take, including over the counter, so the doctor can see all of it right there. By not bringing them, this could lead to duplicative or duplicate prescriptions. Doctors may not know what the person is actually taking and increases the risk of interactions. So when you bring them all there, they're right in front of you and the doctor, feel them, touch them, read them, and it's just more real. And including the over-the-counter, like I said, I'll just repeat that again. All right, number 9 of 10, using multiple pharmacies. So this is easy to do with, looking for the best price or what's convenient on the way home, or maybe you moved and you still have your prescriptions at another pharmacy. So many, or a caregiver may be getting them filled at their pharmacy for you. So this can lead to problems such as no single pharmacist that sees the full list. That's actually like they may see all these medications or maybe not, but certainly if they're not filling them, they're not really spending much time seeing the other medications that you're taking this and this and this. It can be harder to catch dangerous combinations that I was describing and increases the risk of duplicate medications. The last one we'll talk about, number 10, is poor storage. So many times, medications are stored in bathrooms, and bathrooms can be humid, meaning the medications might degrade faster. And heat exposure can reduce potency, depending on how cool the house is or the bathroom. Medications stored in multiple places can cause confusion. So these mistakes are common because the system is complicated, not because caregivers are doing anything wrong. So we'll round out this video in talking about some ideas on how to resolve some of these that we talked about. All right, so we have weekly pill organizers, having something with morning and evening compartments. This reduces double dosing. It makes it easy to see what has already been taken. Using one pharmacy, the pharmacist will catch interactions more likely, and better medication reconciliation, such as how many refills are left, um, and um, and just general ordering is easier, can be easier. Maintaining a medication list. So this is important. Just maintaining a spreadsheet or in your notebook, you've got the name, the dose, the purpose, and the schedule. You bring it to every appointment along with the medications, including over the counter, and you update it after every change. So if you're able to type it out, that's good because then you have that printed copy and then you can write on that and then make changes if something is changed at a particular appointment. You want to make sure that you ask the pharmacist questions. I'm guilty of not asking the pharmacist questions ever, but it's good to do that, to say, hey, is there anything that I'm missing? What are some common mistakes that people make with these medications? What's something that I really need to know? Besides seeing the stickers, let's not rely on the stickers. So I'm telling you that next time I pick up my prescriptions, I'm going to ask the pharmacist, um, just briefly, what are some common mistakes with these medications or things I need to know? So you're asking about side effects, food interactions, and timing. And then let's talk about reminders. You can do phone alarms. You can do smart speakers like Alexa, and Echo, and there might be some other ones. You can use visual charts. You don't need to remember these. So it's not counting, it's not relying on memorization or remembering. You just need a system, the one that works for you, whether it's in a notebook, alarms on your phone, maybe it's your work calendar online where you would put your appointments and your meetings and you get a reminder. So those are some suggestions. So when do you call the doctor? Sometimes there'll be a problem when you call, and if you call and don't get them, you then I recommend sending a portal message. So if you see or experience any new confusion, any dizziness or falls, any severe fatigue, a rash or swelling, sudden behavior changes, and anytime a medication seems to make things worse. And I would add with to that to write down the circumstances. Was it when this happened? What was going on? What time was it? Um, what were you taking? Whether was there any food that was taken with it? What drugs were taken at the same time? So this is going to help the doctor, put the puzzle pieces together because they're going to want to know these things. And um, even myself, I need to write things down like this because I'm just going to forget because there are, just lots of other things that we need to remember, and this is important enough to jot down. All right. So in closing, medication safety is a team effort. It's the caregiver, it's the pharmacist, it's the doctor, it's the person that's receiving the medications. And small organizational changes can help to prevent these emergencies. Remember, we said that many ER visits can be prevented. And you're not expected to know everything, but you're expected to ask the questions and to jot them down and to remember, or at least refer to your notes and know what's super important. So it's not about perfection, it's about protection. And with that, we will close up. Remember, we have our caregiver support group. This topic, and like many of these caregiver coffee topics, are brought up from time to time. So you can come to our group with some of these questions. Now, we're not physicians, but the caregivers have experience with different medications for their loved ones, and they remember them and kind of their experience with them. So I encourage you to check us out, even if it's you've not joined us before, you're just stopping by. Reservation is not needed. A long-term commitment is not needed. You can just come once, and that can be one and done. We hope not, but we're here for you when you're needed. And if that means coming once every 6 months or coming back, not coming back until you feel like you need more help, that's fine also. So we have a wonderful group, whether we're online in Slidell or in Covington, we have wonderful people because they're caregivers, right? And they're speaking the same language as you. So I hope you'll consider that, and hope that we'll be seeing you sometime in the future. Until then, take care.